families, and communities. I want to remind everyone that this hearing is being recorded and broadcasted live on Comcast 8 and RCN 82. Please do silence your cell phones and other electronic devices. I want to thank the initiator of this policy briefing series and the sponsor for today's briefing, Council President Wu, for her partnership and again for her vision for this series of briefings related to the issue of early education and care. This is the sixth of a series of policy briefings hosted by Councilors Wu, Campbell, Asabi George, and myself within the Committee on Healthy Women, Families, and Communities. And as I have made it a point to state at every briefing, we do recognize that early education and care is not a gender-based issue. The four women of the Boston City Council are working on this issue together because Council President Wu recognized that each of us were filing our own respective hearing orders and had areas of focus and concentration, and we thought it would be great just to come together and cooperatively address this issue, which is of relevance to every family and so critical to our workforce and our economy. To date, we have covered a wide range of topics within EEC. Access for families that are experiencing homelessness, professional development for community-based providers, funding mechanisms, as well as transitions from EEC into BPS kindergarten, and more recently, access for families with non-standard work hours. And now today, we are discussing on-site childcare. We'll be joined by our expert, Erin Kelly, who is a professor of work and organization studies at MIT Sloan School of Management. But first, I'd like to quickly recognize my colleagues who have joined us this evening. President of the Boston City Council, Michelle Wu, and again, the sponsor for today's matter that's before us, and at-large Councilor Anissa Sabi George. And I will begin with brief opening statements.
I have none, thank you.
Just wanted to say thank you to my colleagues for our series and making sure that we're returning to this from all different angles, but regularly over an extended period of time. And thank you so much, Professor Kelly, for your time today, and also for all of the research and work that you've done over many years on this topic.
Thank you. Well, Professor, you have the floor.
Great. Well, it's great to be here, and I look forward to our conversation. As a bit of background, I'm a sociologist of work and organizations, and I've been studying how employers address work-family concerns for over 20 years now. It's hard to admit that, but in recent years—
we don't believe it. We thought you were 25. Okay, go on.
And in recent years, my work has focused more on flexibility and employees' control over work time, but some of my earlier work did look at employer-sponsored childcare, and so it was a delight to have this invitation. As background, my perspective is that early childhood education is vital to our communities and the development of our workforces, support of healthy families and children. I also support a shared investment strategy that views this as a public good, as supporting our children's development and supporting workers who have parenting needs is certainly important for all of us to invest in. That said, my research suggests that employer-sponsored childcare in the form of center-based care that happens at the workplace may not be that viable of a strategy for addressing today's childcare needs. And I'll give you a little bit of background that leads me to that conclusion. So in 1997, my dissertation research involved, so that's 20 years ago, my dissertation research involved a nationally representative survey of employers. And depending on what I did with the statistics, between 5 and 13% of workplaces had an on-site child care center. The most recent data that comes from a larger study, the National Survey of Employers in 2014, finds 7% of employers have an on-site or near-site child care center. So in 20 years, we've seen no increase and perhaps a decrease in the percentage of workplaces that are setting up and offering on-site child care. There are many reasons to find on-site childcare appealing. I benefited from it myself as a parent at the University of Minnesota in my previous job, and I know that many people find it really a wonderful solution. And yet, employers have not responded over the last 20 years, and so I'm happy to chat about why that might be. Another interesting finding is that the single most important predictor of having access to an on-site child care center is being a professional or managerial worker. So organizations that employ higher status or higher wage workers who are already doing well in the larger labor market are those that are most likely to set up on-site child care centers. The other key predictors include the size of the establishment. Obviously, larger workplaces are more likely to have on-site child care centers, the size of the organization as a whole, and sector. The public sector and nonprofits, including both nonprofit social services and hospitals, are significantly more likely than private sector employers currently. It also matters the percentage of the workforce who are women, but the occupational status of the workers and the size are the key predictors. And so one implication of that is that the people who are already, quote, winners in the larger labor market are more likely to have access to this appealing form of childcare. On-site childcare is appealing to workers because of its convenience in many cases, and largely because of the high quality of care that tends to be provided in on-site childcare centers. However, many workers are not interested in on-site childcare, either because they don't want to commute with their children, because the cost of that high-quality center-based care is still not affordable for them and their family, or among some hourly workers, it may not be feasible to commit to a certain number of hours of childcare if your own schedule is unpredictable. If some weeks you have 24 hours and other weeks you're only scheduled or paid for 12 hours of work, then having committed even to a part-time slot in an on-site childcare center just doesn't work. And in those cases, it may be more sensible for workers who are facing unpredictable schedules to rely on in-home care, often family and friends. So I think I'll pause there and see if you have questions and see what else I can share.
Well, thank you so much. I think your research kind of backs up anecdotally what we tend to see and hear from families, which is that it's wonderful when it does happen, but not quite sure why and how to expand it beyond the limited pool of usually higher income or more professional jobs. Do you have any sense of, and we talked about this a little bit before, but are there other ways to tie childcare to access points for lower income families or parents? And is the reason why it's not more prevalent for lower income jobs some other barrier? For example, we hear a lot about insurance and companies not wanting to bear the costs of liability insurance for an on-site childcare, and therefore some other barriers that make it a more expensive proposition, and therefore only the certain types of companies will choose to go through those hoops.
Mm-hmm. I think those are important questions. With regard to the barriers that employers face, I would be eager to have an update myself on what employers say currently, but my sense from my previous interviews and from reading recent reports is that there are some concerns about cost. The concerns about liability and the administrative questions, how do we do this, are often handled by contracting with a child care organization so that the employer is providing the space and subsidizing the on-site childcare, but is not trying to actually run it within as a part of their business, right? One interesting point is that there are federal tax incentives for employer-sponsored childcare centers. So if employers invest in childcare centers or actually also in information and referral services, they can take a tax credit on those investments. However, that's been in place since 2002, and we've seen no increase in this period in the number of employers who have responded by adding childcare centers. That may be partly because governments and nonprofits are not covered by that child care tax credit, and those are some of the organizations that my research suggests are more likely to pursue this. It's also the case that many private sector employers don't have any federal tax liability, so the credit is not a financial benefit to them. There are over 20 states with state-based tax incentives, and yet the available data suggests that that hasn't prompted a big increase either. In those cases, it looks like maybe often 5 employers are utilizing the tax credit in a given state. Those data come from an older report, but I haven't seen any updates that suggest that has been an increase. So that suggests that on the one hand, the cost is an issue, and on the other hand, the tax credits are not addressing that costs. And if we tried to, my take is that we have to think about how much more do we want to subsidize employers' subsidies or development, or is it smarter to focus on direct investments or policies that more directly address affordability and access to high-quality childcare? So your first question was about other possibilities. I'm not an early childhood specialist, and so I unfortunately don't know as much as I'm interested in as a citizen on that topic. But there are some states that have provided a tax credit to employers who subsidize a child care investment fund, right? So that they can make a donation to, in these cases, a state fund that increases access or subsidizes the care of low-income families that reaches beyond their own workforce.
And have you seen the impacts?
I have not. I mean, these are also a few states. Yeah. It hasn't taken off in a dramatic and high visibility way.
Okay. I mean, it seems that just from the sessions that we've had over the course of this year, cost is the primary question for families, whether it's cost balanced with how do we ensure we're reaching the right type and hours of care, but also paying the child care workers a living wage and ideally more. Many of the state reforms or even the federal reforms that I've heard talked about involve some combination of using tax dollars to subsidize grants to the workers, therefore helping community-based centers pay their workers a higher wage, theoretically increasing quality and attractiveness to families who may be looking elsewhere for more, more center-based care rather than community-based care. Through your research, do you find that this is the most effective way to use some sort of subsidy to direct it towards the child care workers, as opposed to, you mentioned the employers who might have other costs for hosting a site?
Well, my research hasn't compared the employer-sponsored child care with the other child care investment strategies. But I will say that given the limitations that I see in the employer-sponsored child care path, I think that the other paths are worth exploring, at least in tandem. I would be concerned if we hoped to encourage an increase in employer-sponsored childcare, and we allowed that to crowd out some other strategies, just because the last 20 years suggest that employers haven't jumped on the bandwagon yet. Now, it's great to support those employers who are ready to do so, but I think those are most likely to be larger employers with higher wage workers.
Got it. Okay, thank you. Thank you very much.
Thank you. It is amazing to me, and I think that it's a combination, and I wonder sometimes if it's a combination, certainly of cost, certainly of, and it's newer to me, and I think to the work of Councilor Presley on the hours available, that if it doesn't make sense to access it, why are you going to spend that money to have that childcare? And then also the change in workforce habits, so the more folks telecommuting and working a more flexible work schedule, even in those higher management level positions where there is some more flexibility in how we work. I think all affects, it impacts all of this. So I'm just, it's interesting to me, and it's also fascinating to me that businesses aren't taking advantage of any of the incentives, whether the state or the federal. Does Massachusetts have an incentive? Is it one of the 20 states?
Not to my knowledge, at least as of the report that I could access, I did not see one, yeah.
And then on the federal tax incentive, would that be changing in the new the tax policy changes that we're looking, to see, and with this current?
I haven't seen mention of that in the massive tax bill. I know that there was, as part of the current administration's discussion early on, there was the possibility of expanding those tax credits, but the research suggests that they're not being utilized as they are, as it's currently set up.
And then, is there any distinction between specific employer-based childcare? So you imagine one of our big businesses that occupy a whole lot of square footage, that they've got some sort of center, whether they run it or they contract it out, in relation to more of a demographic, so numbers of businesses that coordinate their activities together to have a childcare center in a particular part of the city.
Right, so my understanding would be that employers' contributions to a center would be, could receive that tax credit even if they don't run it exclusively. So it does make a lot of sense to have a consortium of businesses that considered, going in to support a local child care center near their work locations. And I think that those employers would still each be able to take advantage of their portion of the expenses.
Thank you, that's it for me, thank you.
Well, unfortunately, I had to step out, so I do apologize. I didn't get to hear the totality of your testimony while I was back in the office. So I do hope you'll be, do you have a copy that you could provide?
I don't have a written copy, but I can provide some notes.
That's
sure.
okay, I'll watch
Yeah.
the tape.
Okay.
Okay, thank you so very much.
Thank you.
For being here and
My
for
pleasure.
your commitment to this issue. Okay. Sure. Oh,
So,
sorry.
That's fine.
no, Professor, I guess just to wrap up then, any specific recommendations, whether particularly related to this topic of on-site childcare or not, that you would hope the Boston City Council or city government might think about?
Sure. I think that the focus on improving access to high-quality childcare is very important, and so I wish you well, and I'm excited to see what you pursue with that, with regard to that. I agree with you that the focus on teachers' wages and how we can support a living wage among early education teachers is important, because that's related to the quality of care that our young people get and to the shortages and the opportunities that parents have. The other thing I would mention is that addressing the concerns, the work-family concerns of low-wage workers includes addressing childcare, but also paid sick and family leaves, and considering how we can support reasonable schedules. So being sure that workers have some advance notice, to their schedules, or there is some sense of predictability so that they and their families can plan their lives, take care of the work that they need to do, but not be faced with the chaos of always changing schedules.
Got it.
Great.
I'm sorry. We were going to adjourn, but Council President Wu has now prompted me to ask
Sure.
a question. And I wasn't going to ask what I didn't think it was fair since I didn't hear your testimony in its totality, but I do look forward to watching it, and I may circle back.
Sure.
I don't know if these things were already asked, so please do forgive me if they've already been
No
asked.
problem.
And feel free just to tell me to watch the tape. So the first is, has there been any sort of mapping of the number of on-site childcare? Do we have that?
I'm not familiar with that. I
Okay.
had wondered whether the Bright Horizons team might have access to that because they are one of the primary vendors of on-site childcare across the country.
Okay.
And so we might be able to find that for our local.
And it's actually been one of the things we've
Organization.
been exploring as our own sort of working group, if this is the role that the city should be playing in terms of data collection and that sort of thing, to inform where we make investments in that, and the like. So, thank you for that. And then my second question, again, I apologize if you already went over it, is when you say high-quality care, there's a lot of debate about, how we define quality and what that is. And for those that are defining quality according to professional development and accreditation, we have found for this workforce that is incredibly daunting for them already in low-wage jobs, and again, balancing their own families, that a number of the hoops that we're asking them to jump through, those who have had family and center-based facilities for quite some time now, wanting to develop their skills, that it can be costly and inconvenient, and so access to those professional development opportunities might be something we need to look at as well. But I was just curious as to how you are defining high quality.
Well, I think for center-based care, it's a little bit easier because there is some national accreditation. For other care, which I completely agree can be very high quality, I think it is harder to define, and that is, again, outside of my area a little bit because I'm not an early childhood scholar. Sure. I'm a organization side, employer side scholar. My hunch as a parent, and I am interested in your perspective, is that things like having consistency of care and consistency of routines is very important within in-home and child care centers that aren't accredited by the national associations, and those are affected by the child care workers' wages, certainly, right?
Absolutely. Okay, thank you.
Thank
you
you.
very much, Professor. Councilor Sabi-George?
I'm good, thank you.
Okay. Well, again, thank you so much
Sure, my
for spending
pleasure.
time with us this afternoon, and I expect we'll be seeing more of each other.
Sounds great. Thank you.
All right. Any other expert testimony this afternoon?
We're working on Bright Horizons with the scheduling.
Okay, and is there anyone who would like to testify publicly? All right. Well, I think we will adjourn.
It's a big one.
Yeah, the gavel
gavel
seems
is
so
so
heavy.
heavy.